Hi, my name is Brandon Todd of Medigap360.com. Welcome to my presentation on the 8 truths that every senior should know before purchasing a Medicare Advantage plan. Number 1, do not compare the premium of a Medicare Advantage plan to a Medicare Supplement plan. A common trick many Medicare Advantage salespeople use is to try to compare the premiums of a restricted Medicare Advantage plan to that of your comprehensive Medicare Supplement policy. However, lower price is no more reason to buy a Medicare Advantage plan and give up Medicare Parts A and B than it is to buy a scooter rather than a Cadillac just because it costs less. To compare prices and come up with a good decision, you must make sure that you are making apples to apples comparisons. This is practically impossible with Medicare Advantage plans and Medicare Supplement plans, as they vary in benefits and structure. Medicare Advantage plans are only required to be similar to Medicare Parts A and B alone, not Medicare Parts A and B when paired with a Medicare supplement. And this is federal law. Federal law requires that all Medicare Advantage plans be equivalent to the Medicare plan, equivalent or better, and not equivalent to Medicare Parts A and B with Medicare supplement. So when your Medicare Advantage salesperson tries to sell you saying, look at the premium of a Plan F Medicare supplement insurance compared to the premium of a Medicare Advantage plan, realize he's not making an apples to apples comparison. What you're doing is restricting your health care options and taking lesser coverage for a lower premium. Of course that would be a lower premium. Medicare supplement plans, along with Medicare Parts A and B, normally offer many more benefits and freedoms than Medicare Advantage plans. And in the end, you get what you pay for, don't you? Number 2, to enroll in a Medicare Advantage plan, you must give up coverage from Medicare Parts A and B. If you choose a Medicare Advantage HMO, PPO, or private fee-for-service plan, you will be disenrolled from Medicare Parts A and B. Now, you'll still be in the Medicare plan, in the Medicare system, that is, but you won't have coverage from Parts A and B. A private insurance company will now take care of your insurance. The federal government via Medicare will then pay the Medicare Advantage plan to provide for your health care. The plan may require you an additional premium and may charge you a copayment each time you go to the doctor. And to join a Medicare Advantage plan, you must both have Medicare Parts A and B, not have end-stage renal disease, and live in an area that has a plan. Not all plans are available in all areas of your state. And that's just kind of an overview of your eligibility. Number 3, you can have increased control over your choice of healthcare providers with Medicare Parts A and B alone rather than a restrictive Medicare Advantage plan. Medicare Parts A and B allow you to choose any physician or hospital in the United States. And in critical times, this freedom to choose and access the best providers could make a huge difference in treatment and even save your life. As we all know, all health insurance or health providers do not offer the same services. You can go to a heart specialist and receive life-saving treatments that regular doctors can't give you. In the same manner, you can go to cancer treatment specialists and cancer treatment centers that boast a lot higher survival rate for many types of cancer than your local treatment center that would treat cancer if you went and asked them to. So in critical times, this freedom to choose and access the best providers could make a huge difference and even save your life. Medicare Advantage plans are not so flexible, possibly with severe consequences. And we're talking about your health and your life here. Medicare HMOs and PPOs will require you in most instances to only use physicians and hospitals in the PPO or an HMO's network. If that cancer treatment center is not in that network, you're out of luck, Chuck. You can generally go to any doctor or provider you want with a private fee-for-service plan, but you must find a provider that will treat you and accept the plan's terms and conditions. Now, I'm finding more and more every day that doctors are not willing to work with the complicated procedures that are involved in private fee-for-service plans. And the claims hassles and everything else are just too much for the doctor's offices to want to put up with. So we're finding a lot more are either not accepting them or were once accepting them and now no longer accepting them without letting their patients know until it's too late. So it's kind of a mess and something that you need to be aware of. Doctors may stop accepting private fee-for-service plans without notifying you, leaving you stuck in a plan without your physician, without Medicare Parts A and B. And I just mentioned that. It happens all the time. And then what happens is people will have to either go to a physician that they haven't been going to that accepts the plan, or they're going to have to pay 100% out of pocket. They can't go back to Medicare Parts A and B right away just because that happened. And number 4, Medicare Parts A and B alone. This is important. Without a Medicare supplement can provide you comparable benefits to a Medicare Advantage plan. Remember, the law requires that Medicare Advantage plans be the actuarial equivalent of Medicare Parts A and B, not of Medicare Parts A and B along with Medicare supplement insurance. So they can do this without restricting your ability to choose your healthcare providers, which we all know is very important, and without putting administrative restrictions on your physician for claim payments and referrals. Why Medicare Parts A and B alone is better than Medicare Advantage plans? Well, Medicare Advantage plans must provide at least the same benefits or actuarial equivalent of Medicare. However, this can be deceptive. What this means is they will offer you benefits based on dollar amounts only that will average what Medicare offers, though they may package the benefits differently. And that is basically that second bullet point is just a definition of what the actuarial equivalent is. I know it's a big word. Packaging differences can be best explained by taking a dollar away from you in one place and giving it back in another, which maintains the actuarial equivalent. So maybe they're going to have a low doctor's office copay, but they're going to have a higher emergency room copay. There's a million moving parts in an insurance policy, and they can move them around as they see fit. However, though the average payments will still be similar after care has been received, Medicare Advantage plans may restrict or delay you from receiving treatment at that you would choose if your insurance coverage allowed you whatever you wanted. What that simply means is you can't go where you want to go. Preventing you from getting the care or choosing to get care means big profits to Medicare Advantage plans. And what this means really simply is if you don't go and get care, if you feel like you shouldn't go, then that claims loss is not realized by the insurance company. Anytime they can stand in your way of getting treatment and having to pay a claim, which turns into a claim for them, is a dollar that they've made. And number 7, a Medicare Advantage plan will restrict your right to choose your physicians and hospitals, even with private fee-for-service plans, possibly resulting in serious health consequences. So Medicare Advantage plans only require that they offer you a certain type of health care. For instance, if you needed treatment for colon cancer, they would have to allow you to see physicians in hospitals that treat cancer. However, they wouldn't have to allow you to find the best treatment possible or a specialist that treats colon cancer. They only have to allow you to get treatment for cancer. And we all know the difference in a treatment center or a physician that treats colon cancer is better than someone who treats this kind of cancer one day, another type of cancer another day, maybe a broken leg another day, and who knows what all the people, the doctors, the hospitals are treating that would treat you. Someone who specializes in your field of the disease that you have can make a tremendous impact on your well-being, your life, and even save your life. But with Medicare Advantage plans, you don't get that option. What's worse, if you decide to use a provider that's not in your Medicare Advantage plans network and pay on your own, you'll be responsible for 100% of all costs. And then the question is, why have you been paying into Medicare and paying these premiums all of your life when it comes down to when you really need it, that you end up having to go outside your network to save your life, and you end up paying out of pocket 100%. And will you really be able to pay out of pocket is another consideration. Cancer treatments are up around 50, hundreds of thousands of dollars. It can be really rough. A Medicare Advantage plan may choose not to renew their contract in Medicare each year in any area. Oh, this is a great one, and I see it happen every couple years with Medicare Advantage plans. You'll no longer be allowed to participate in the plan. Just once a year they'd say, you know what, we're not making enough money in XYZ County, and so we're just not going to offer any coverage there anymore. And all the people on the plan are automatically out of their plan now. They just don't get coverage. Unlike Medicare Supplement and Medicare Parts A and B that are guaranteed renewable for life, you know you get the same thing. It's good comprehensive treatment, and you can keep it as long as you can stay on it and pay the premiums. You can always have that plan. Medicare Supplement plans and Medicare are guaranteed renewable for life, as I said. You can never lose Medicare Supplement coverage as long as you pay. So let's wrap this up. Let's remember what's important about making healthcare decisions with health insurance, which is what you're doing. You're making healthcare decisions. Remember, the reason you have health insurance is not solely for the sake of having health insurance. Health insurance for the sake of merely having insurance is boring and really expensive. But you purchase insurance to ensure that if and when health problems do occur, that you'll be able to receive the best quality health care possible without regard to the cost involved. Many seniors make the mistake of purchasing health insurance based on the monthly cost, possibly exposing themselves to serious health risks caused by reduced access to health care. And when I say this, the mistake that many seniors make is saying that they get duped in by a Medicare Advantage salesperson comparing the premium of a Plan F to the premium of their Medicare Advantage plan. And so they think they're saving money when in essence they're getting lesser health coverage, and they're getting reduced access to health care and can't choose their doctors and hospitals anymore. And they get a lot less, but they feel like they're paying a lower premium when their actual out-of-pocket cost might not be any less. Remember, the decision you make now will determine what access to quality of health care you get in the future. So the right decision can add years to your life and quality of life to your years. And thank you for listening to my presentation on the 8 truths every senior should know before purchasing a Medicare Advantage plan. I hope you found this helpful. There's a lot more valuable information. I've been in the business for about 11 years helping senior citizens, and I put all of my presentations and flip charts into this kind of format, and I keep them there on the Learning Center at Medigap360.com. Please feel free to go visit there and spend as much time as you like learning about Medicare, Medicare Supplement, and Medicare Advantage plans. My name is Brandon Todd, and I'll talk to you soon.